Hello.
Hello.
My name is Adriana. I'm a nursing student from Clearwater College. Can I have your name and date of birth, please?
Jennifer Aniston, February 1966.
Okay. Ms. Aniston, do you have any allergies?
No.
Okay. So what we're going to be doing today is I will be performing a chest and abdomen assessment on you. And I'll also be taking a set of vital signs, which is your blood pressure, your heart rate, your respirations, your temperature, and your O2 saturation, okay? Are you in a comfortable position for us to start our assessment?
Yes.
Okay. So I will be starting with the general appearance portion of the test. Ms. Aniston, can you please smile for me? Make a sad face, a mad face, okay? Do you know where you are right now?
Clinic.
Okay. What have you had to eat today?
Eggs.
Okay. So looking at my patient's mood, she is calm. She doesn't seem in distress or agitated. Her hygiene is also normal, and her skin color is appropriate for her ethnicity. So moving on to the measurements portion of the test. Ms. Aniston, on a pain scale from 0 to 10, 0 being no pain and 10 being the worst pain you felt, can you rate your pain for me?
0.
What's your height and your weight?
5'4", 170.
Okay. And so now I will be moving on to taking her vital signs. I will be starting with the blood pressure. That's not too tight, Ms. Aniston?
No.
Okay. So first I'm going to be palpitating for her brachial artery. Okay. I could no longer feel the brachial artery at 140, so I am deflating the cuff, and now I will pump it to 160. I am disinfecting my stethoscope. Okay. Her blood pressure reads 120/70. And now to move on to her heart rate, I'm going to be palpitating the radial pulse. Okay, and her pulse does seem even, and the amplitude is +2. I will now be taking the rate. Her heart rate is 78 beats per minute. And like I said, even, and the amplitude is +2. Now to take her respirations. Ms. Aniston, can you please place your arm over your chest and just relax for me? Her respirations are 18 breaths per minute. And it's even and unlabored. Okay, now to move on to the temperature and the oxygen saturation. I'm going to place the pulse off in your finger and just relax. And have you had anything to eat or drink or smoke in the last 30 minutes?
No.
Okay, please open your mouth, lift up your tongue, and close your mouth. Beep, beep. The temperature shows 98.6. And the oxygen her oxygen shows to be 99. And I am disinfecting the thermometer. Okay, now to move on to the chest portion of the assessment. Ms. Aniston, have you had any cough in the last couple of days?
No.
You haven't been coughing anything up?
No.
Okay. So are you in a comfortable position to go ahead and start?
Yes.
Okay. So I am moving on to inspecting the anterior and the posterior part of the chest. Normally my patient wouldn't have a shirt, but for the sake of privacy and just for this video, we're going to keep the shirt on. With my pen light, I will be assessing my patient's posterior and anterior chest for any deformities, abnormalities. I will be also assessing her skin. In this case, my patient's skin is appropriate for her ethnicity and her anterior and posterior chest. While my patient is in this position, I'm going to go ahead and auscultate for the lung sounds. Ms. Anderson, every time you hear my stethoscope, just take a deep breath, okay? Okay. No abnormalities in her lung sounds posterior. Now I will be auscultating her anterior on all 4 quadrants. Just take a deep breath when you feel my stethoscope. Now while I'm here auscultating her lungs, I'll go ahead and auscultate her heart sounds. You don't have to take a deep breath, just relax. Normal S1 and S2 sounds noted. And I will now move on to palpitating my patient's chest. Miss Anderson, if anytime you feel pain, just let me know, okay? You don't feel any pain?
No.
No pain there?
No.
How about here?
No.
Okay. Here?
No.
Here?
No.
While I'm already in this part of the chest, I'll go ahead and palpitate for the PMI. And her PMI pulse is not bounding. So now I am going to move on to the abdominal portion of the test. Miss Anderson, can I please have you lay down on your back? Let me get that pillow for you. Okay. Are you in a comfortable position?
Yes.
Miss Anderson, have you had any problems with your bowel sounds, bowel movement lately?
No.
When was the last time you had a bowel movement?
Yesterday.
Okay. So I'm going to begin by inspecting her abdomen area. Again, the patient wouldn't have a shirt at this time, but we're just going to keep it down. So just like the chest, I am inspecting for any abnormalities in the skin, any lumps or bumps, the shape of the stomach, if it's flat or distended, and everything seems normal with my patient. I'm now going to move on to the auscultating portion. I will be auscultating for bowel sounds, and I will be starting in the right lower quadrant. Okay. Moving on, I am now going to percuss the 4 quadrants. Okay, now I will be palpitating the 4 quadrants. Miss Hanson, just let me know if you feel any pain, okay? You feel any pain there?
No.
How about here?
No.
Any pain there?
No.
Any pain there?
No.
Okay. So now, Miss Hanson, you can go ahead and sit up. Now, I'm just going to ask you, can you please take a deep breath for me? Okay. Her anterior and posterior chest, they do inflate symmetrically, and her respiration at first seems normal. I am performing hand hygiene, and I have documented my findings.